I'm Katie Remus with Carestream. I'm here with Dr. Perez. Thanks for coming by.
Oh, you're quite welcome.
So you've been at the show for a few days and also very busy with your own center. Tell me, what are your top challenges in diagnostic imaging that's on your mind these days?
Well, I think that the hard thing is doing more with less, making sure that we keep up with the amount of volume that has to be done, making sure that we meet the patient's satisfaction and in their timelines to fit into all of the imaging that needs to be done, both on an inpatient side and an outpatient side. So it's always maintaining that volume, how many patients you can put through comfortably, and keeping up to make sure that the information is flowing between systems. So it's the challenge of the system and making sure that you get your orders in and then you get your exams done, get them read, and get them back to the report so that this way here determinations can be made to help the patient care.
Which contributes, you're talking about patient satisfaction being even more important than ever before, and how the productivity adds to that.
Because those are the things that appear on the comment sections, and a lot of your surveys and the rest had to wait, not on time, didn't know what I was having, or sometimes, and it's not necessarily all radiology, but it's like, it's what happens in the system. And as you go through the process, and of course, time as a patient appears much longer than what it really is, because you're there, and it's like, how do you do that better? Now, those are the things that we look at, that efficiencies and the rest, but while keeping the care. Sure. So that this way here, that they feel that personal touch is there, because it's still very important, the relationship that comes between the technologist and the patient.
You'd also, talking about patient care, you were talking about controlling dose and recording the amount of dose, especially in fluoro.
Well, I think that's as we sit down and we look at the technology and the newer equipment like the Carestream's new fluoro machine and the rest, those where we're getting lower doses to get better images, is very important as you go forward. And it's also part of the new regulations to make sure that we all follow ALARA, which is as low as reasonably possible in our dose and the rest, and then it's documenting it. So how do you do that easily? And it can't just be on a piece of paper. Going forward, they want that integrated. They want it in the DICOM header. They want it to sit there so that eventually we will have to find out what is your lifetime dose. So it's going to be accumulative over time. And the CT fluoro being your higher doses and the rest. So how do you keep track of all of that? Where does that fit into the patient record? How does it all fit together? And it's our job to make sure that we get the information we need. So it's a challenge.
So, and another challenge was just keeping up with technology. And you're talking about maybe how Carestream helps you do that.
Well, Carestream's been very good about looking at its software and the upgrades to their equipment and the rest. They try to sit down even the transitions between pieces and the rest as they come in, making sure the doses and everything are there. They help with that transition. They are part of the team. They make sure that the equipment is operating properly. We go through our physics testing, we go through the different requirements that we have to do, but we also then have Carestream that comes in and makes sure that everything is running and repaired as quick as possible. Maintain the batteries and everything else that's involved with the systems. And it's got so many moving parts that it's difficult to sit down and think about how does it all fit together. And I think that's a hard thing for most vendors and the rest. They're part of the system. They're part of the overall process that happens in taking care of a patient.
Yeah.
Because their equipment is just as important as the tech and just as important as the technology that's used.
So a lot of moving parts. A lot of moving parts in the technology, with productivity, with patient satisfaction.
And a very long day. 24/7 is real.
Yeah. Well, thanks for stopping by and sharing your thoughts with us.
You're quite welcome.
Thanks
so much.